Okay, well, welcome to another edition of TEPHI Talks. This is a production of the Texas Epidemic Public Health Institute. My name is Bob Emery, and I'll serve as the host of this session. We have a pretty exciting session that's coming up here as well. So some folks that will be speaking specifically about the public health interactions with the business sector and how we can all work together to address the challenges from public health threats, but also to maintain business operations as we go along. Before I go on, I'd like to introduce the Deputy Director of the TEPHI, which she'll define again, Dr. Janelle Rios, to describe what it is with regard to the mission of TEPHI, and then we'll get back to the presentation today, and I'll introduce our two speakers.
Wonderful. Thank you, Bob. Hello, everybody, and thank you so much for joining, especially with our esteemed guest speakers here that Bob will introduce shortly. I wanted to spend just a few minutes talking about the Texas Epidemic Public Health Institute, or TEPHI, as we affectionately call it. Our mission, as we have been funded by the state of Texas, is our commitment to keep Texans safe and the economy strong by strengthening the capacity and the resiliency of all Texas communities to respond to future infectious disease outbreaks. And this free webinar is one of those ways that we do that. Another way that we do that is through our extensive collaborations. We have cultivated partnerships with many different types of organizations, including many government agencies at all levels, at the federal, state, and local level, especially here in the state of Texas, through regional and statewide organizations, many professional associations, other business entities, nonprofit institutions, academic institutions, and community organizations. And we are very happy to create these partnerships out in the world. And we'd like to partner with you all as well. So if you are interested in connecting with us, on this screen, you'll see a few ways of making those connections. I'll draw your attention, I'm not sure if you can see my cursor, to this online certificate program, which is in the upper right-hand corner. It's a fabulous program of 5 courses, and 4 are at your own pace that you can take at any time at your convenience. And then the 5th course is a fun online tabletop exercise where it culminates everything that you've learned in the 4 prior courses. Another highlight here is the Texas Public Health Summit that we do every fall. You can join online or in person. If you come in person, we guarantee you a lot of fresh coffee and some lunch, as well as really wonderful networking opportunities. And our date this year is September 25th, 2025, here in Houston in the Texas Medical Center. And a little bit about TEPHI Talks. So the TEPHI program is wide. We employ scientists. We partner with many scientists, epidemiologists, again, at many different organizations. But this particular event, the TEPHI Talks, is special because with TEPHI Talks and through Bob or Dr. Emery's group and his team, we are focused on engaging businesses to prepare to successfully maintain operations during an outbreak situation. And that aligns with our mission of keeping the economy strong, is because we want to keep Texans specifically healthy and our workforce healthy so that businesses can continue to operate safely. So that all being said, let me get to some webinar housekeeping items. You'll notice that you all are muted. That just makes for a nice venue here so that we can hear our speakers more easily. If you have a question, and really, please, we encourage you to ask questions. Please use the Q&A box at the bottom of your screen to ask questions. It makes it easier for us to monitor that one box, and then we'll present or pose your questions to our presenters. If you're interested in closed captioning, there's a button at the bottom of your screen that says live transcript. And once you press that, it's going to open up the closed captioning. We are recording this webinar, and we have permission from our speakers to do so. In about a week, you will receive an email for anybody who registered. You'll receive an email saying the recording is ready and you'll be able to view it on our YouTube channel. And finally, we have a survey. Once you close the webinar window, you'll have a survey. Please tell us how we did with this particular event, and let us know if there's any other topics you'd like to see in the future. So we are awarding continuing education units for those who have certificates in public health. I'll stay on the screen for just a moment so that you can scan that QR code and register for those continuing education hours. And while I'm on here, I'll tell you that TEPHI is housed within UT Health Houston. That is short for the University of Texas Health Science Center at Houston. And most of us, pardon me, are located at the School of Public Health, which is the best school. I know the UT Health Houston has 6 schools, including medicine, dentistry, nurse, and we have a lot of schools, but I think that the School of Public Health is the best one. And others agree, because nationwide, of the 209 schools of public health, we are ranked number 25. And if you look at only those schools that are publicly funded, we are ranked number 9, which is wonderful. So with that, I am going to turn it over back to Dr. Emery so he can introduce our speakers.
Great, thank you. Thanks, Janelle. Yeah, so it's my pleasure to introduce our 2 speakers. Dr. Gillian SteelFisher is a principal research scientist at the Harvard T.H. School of Public Health. She serves as the director of the Harvard Opinion Research Program, and her work focuses on the intersection between research and practical application in public health communications, which warms my heart, by the way. So I can't wait to hear your presentation. And then Sarah Bounse is a program officer at the Beaumont Foundation, where she manages a portfolio of public health programs, projects, and grants focused on strengthening partnerships, improving communications, and advancing policies to support health and equity. Both these individuals have extensive experience in the field of public health, both academically and in practice, and their impressive bios are posted on the website for those who want to get additional detail. A quick word about the Beaumont Foundation. That foundation works to strengthen business engagement in public health with the goal of advancing community health, along with supporting emergency response and preparedness. And so this particular seminar is going to focus, I believe, on this survey that was conducted in collaboration between these 2 entities. And I'm very interested in hearing the findings. So thank you so much for taking the time to join us, and I'll turn it over to you.
Thank you so much. We're really excited to be here today and looking forward to digging into some of these questions. So as Dr. Emery mentioned, my name is Sarah Bounse, and I'm excited to be here to talk to you all about public health approaches to private sector challenges. And so we're going to dig into a little bit about what the Beaumont Foundation is doing around engaging with the private sector on public health issues. And then Gillian will be talking through the poll that we've put out there on how private sector and how folks have really viewed the policies of the private sector in work in the wake of COVID. So really looking forward to hearing from Gillian on that too. So just what to expect, we're going to do an overview from me, and as I mentioned, Gillian will then go over the polling results, and then we'll have a bit of a Q&A at the end. So please continue to add your questions to the Q&A function, and we will try our best to make sure that we can answer all your questions. So we already kind of heard a little bit about Beaumont. Just want to reiterate that we are a private foundation that is focused on public health. Our vision is a community where everybody has the opportunity to be as healthy as possible, no matter where they live. And so the work that we do in all of the spaces that we work in is to get to that point. And so our private sector work and private sector partnership work is all to that aim as well. So you already know who we are, so I'm not going to belabor the point there. So, want to talk a little bit about how Beaumont really views how the private sector can play a role in public health. We really believe that achieving economic and social prosperity really relies on having healthy and safe places to live, to work, and to play. When we don't have those environments in our community, it is really hard for people to feel equipped to access prosperity, to access the ability to take care of themselves and their families. And so it's important to have all of those things in your community so folks can reach economic prosperity and social prosperity. So the community that often folks in business are seeing, you all in business are seeing, are your employees, right? This is the community that you may directly serve, right? As they're people that are relying on you, that are working in your organization and your business. And these are folks that you're engaging with on a regular basis. Your community is also your customers. So the people that you're providing services and goods to, right? This is your community, and these are the folks that you are engaging with on a regular basis, right? To provide something that they need in the future or in the current day. And then your community is also your future, right? So if we think about how the broader community that you exist in, that we all exist in, these are folks that could be potential employees. These are people that could be potential customers. They're also people that impact the lives and the livelihood of the people that you're engaging with as employees and customers on a regular basis. And so if our communities are not thriving, then it's a lot harder to have thriving employees and thriving customers that can then reach out to you and use your products and your services. So the Beaumont Foundation has put out and done some research in this work, in this space of business and public health and how the two can intersect and should intersect. So we released this report in 2019 called Good Health is Good Business. And this was released in partnership with the Bipartisan Policy Center. And so what we found in this research is that community health and business success are really closely linked, which I don't think should surprise anybody, but we found that pretty clearly in this report. What we found is that when you have poor community health, this is directly impacting the health of businesses' employees, your customers, and your supply chain partners. And so you all have probably heard this data before around how productivity losses related to family issues and problems and family health problems, employee health problems, cost the U.S. employers a ton of money, right? About $225 billion annually, which obviously adds up, right? So again, just reiterating the point that companies and businesses really depend on communities to provide healthy employees. And if we don't have that, then your own work, your own initiatives and your efforts really are not going to thrive because you don't have that healthy base of folks to reach out to and to engage with on a regular basis. And then, it works the other way, right? People and communities need strong and healthy businesses to offer jobs, to offer stability, and to offer economic support and the ability to grow in their own community. So continuing with this report, we found that really businesses are impacted and impact 4 areas of health. So the first is consumer health. So organizations really impact the safety, integrity, and healthfulness of the products and services you all offer. Employee health is also impacted. I think it's a little bit more obvious, right? You impact the health of your employees through health insurance, workplace safety and culture, and other programs to support wellness and health in your business. You also impact community health by how you do business, where you're doing business, how you're operating, and how people are engaging with your business. And then obviously environmental health, right? So how do your policies impact individual and population level health? And environmental policies, how do they in the long run impact communities? So those are the places that we found business really intersects really closely with health. So we have some recommendations from this report. So some of these are seem pretty obvious, but just wanted to name them for you. So the first is really thinking about if you are working in a business, like how do you make sure that you're engaging with the right people and the right partners? If you're thinking about how do we ensure that our community is healthy, our employees are healthy, the people we serve are healthy. One way to do that is really look at who are the partners in the space in which you work in. So obviously TEPHI is one of them, but you can think about your Chamber of Commerce, you can think about your local health department, you can think about other potential partners to engage with there. Really thinking about how would you want to engage with those partners. So what is a specific ask that you might have for your chamber versus for a local health department? Do you want data and information about a particular issue? Or do you want to navigate and problem solve together? Like, what are the asks that you're trying to create and come to consensus with together? Really engage with people to serve as champions for whatever you're trying to do to address the health of your employees, your community, the other folks that you're engaging with. Focus on common problems, which again feels pretty obvious of like, really, let's think about where is there overlap that public health is trying to address issues and where you are trying to address issues. And then just measure the successes and impact of the work you're doing to show that this is possible, you're able to create change and improve health of your employees and your community. So one other report that we put out in 2021 is called 7 Ways Businesses Can Align with Public Health for Bold Action and Innovation. So this is another report that really digs into sort of the tactical and practical steps that businesses can take to strengthen partnerships and to improve the health, again, of your employees, of your communities, and just folks across the nation. And so these recommendations were really built out of focus groups and personal interviews with 40 business leaders and public health leaders about how. And again, you can see the date of this, right? 2021, in the immediate wake of COVID and the impacts of COVID on the business sector, on the private sector, and the workforce, really trying to mitigate and really figure out how do we address these issues on the health and well-being of Americans, and what can business do to do something about that. And again, Gillian's going to go into this a little bit more in detail, but just wanted to frame this as a report here. So some of the recommendations are pretty obvious, but we wanted to again say these were the shared recommendations from a whole group of people that are doing this work in the private sector and in public health. So the first is, right, what are the immediate needs that your community has, or your employees or your clients or your patients have, or your customers have, and try to address that issue. So in COVID, obviously it was, well, we're shut down, right? So how do we address this particular need? Now it might be, okay, we're dealing with lots of instability and costs around lots of different items that people are trying to buy, right? So how do we mitigate that, and how do we address that fire and try to put it out? Second is, again, really focusing again on the health and well-being of your employees. That seems to be a really big theme across the board. It's a really important way to navigate and address health issues. Promote healthy communities, and become a force multiplier. So again, amplifying work that's happening to address public health that's going to impact you and your employees and your customers, just being able to amplify that if you're able to in your role as a business leader. And then actively facilitate public and private partnerships. We found that partnerships work is often the most successful way we can get change done and to address a lot of these health issues on a broader level. And so we want to amplify that. And we found that those are some of the big recommendations that came out of these conversations with folks. So just want to briefly touch on what Beaumont has done in the space beyond those two reports. And so the first is in 2022, Beaumont put together a program called the Innovative Multi-Sector Partnerships for Community Transformation in Public Health grant. And so essentially this was really to foster collaboration between governmental public health departments and private sector by really supporting a cohort of folks that were doing this partnership work on a local or hyper local basis to really advance community health. So we had multiple groups of folks from various places across the country, actually primarily rural communities, that were really trying to address issues like childcare, trying to address stuff like access to healthcare, trying to address folks getting access to community health workers to support their employees. It was a real mix of issues, but really it was a partnership to address some of these issues so that particularly employees in those businesses could gain access to being healthier, essentially. And so that was a program we did. We sunsetted it at the end of last year and learning from it right now, and are kind of trying to figure out next steps with the work we're doing. The second area that we have invested in and we put work in is called the Health Action Alliance, and so, or also known as HAA. And this is actually a private business that is a partnership between leading businesses, communications, public health organizations to really champion policies and practices that advance health and safety and that are also good for business. And so HAA really is for businesses. They touch on public health, and public health is one of their main goals in the work that they do, but they really deeply engage with businesses of all sizes, from Google to Meta to folks that are mom and pop stores and shops across the country, and really providing guidance and resources to folks, again, created out of COVID of what are the policies that we need to support our employees and our customers, and now gotten to a point where they're addressing some major health issues at the local level. So I highly recommend you look into them as well. Also right now, some of the work we're doing is really, like I said, we're learning more about private and public partnerships across the country and trying to develop guidance and findings based on some of our learnings to be able to share with businesses, chambers of commerce, and health departments on how to partner together to improve community health. And so some of the big work, obviously, though, that we're also doing is polling. And so I want to turn it to Gillian to kind of talk a little bit more about our current environment that we exist in, and like the ability to then develop recommendations for future public and private sector actions. Here's some resources, and again, these slides will be shared with you later, but just wanted to put the reports here as well. And with that, I'm going to turn it over to Gillian.
Thank you so much, Sarah. And thank you to everyone who's come today to spend some time with us and think about these important issues. I always feel like there's nothing as exciting as hearing Harvard people talk about data over lunch, which is probably what's happening right now. And I just want to tell you, it's going to be pretty exciting. So the reason it's going to be exciting, and it's not just going to be data in an abstract, is that polling is really interesting. It's really exciting. It's our way of understanding what people think in a systematic way and taking all those different voices and amplifying them so that we can really think, okay, well, how do we incorporate people's perspectives into what we need to do in terms of policy making, communication, and connectedness. So we conducted a poll together with Beaumont last year, and it was really to try to understand, like, okay, what happened after COVID, right? There's a lot in the media about how people view things and what happened and where people are going, and some media outlets will tell you like there's no hope, like in the future no one will ever listen to anything about public health. And other people are like, oh, we're buckling down, we're never going to not wear a mask, right? It's so divided. And one of the beauties of public opinion polling is that it gives you a perspective that's beyond what the media is reporting. It's beyond what's on X, it's beyond what's on sort of other social media platforms that might have a particular agenda or perspective in sharing those views of what the public thinks. This is ultimately a more objective assessment. And so, I do polls all day because I find it a really useful tool in terms of understanding. In this particular context, I think what it can do is help businesses and public health organizations to do a couple of things that we need to do in a pandemic when we're trying to keep operations going, and we're trying to keep the communities healthy, and we're trying to keep the economy going. First is try to anticipate where there's support for specific policies and where you're going to find more resistance. The second is to try to actually develop policies that people are more likely to comply with. What you have to think about in terms of specific features of design, and how can you put together a plan that will try to preview that as much as possible. And then also, how can you communicate those policies effectively with your employees, with your customers, with sort of extended consumers, and with communities that you're in. Now, these findings will give us broad guidance. We know that the real life details of whatever happens will matter. We all know that. But as we also all know, and we've all been in pandemic preparedness and seen what's happened in COVID, starting with a plan, even if you have to adjust it, is better than just like coming into a blind. So that's the goal here, is try to give ourselves a head start and think about what can be actually done ahead of time and plan for. So when I say a poll, what do I really mean? What I'm talking about is a poll that is a representative sample of people across the country. This particular poll was conducted in the spring of 2024, between March 21st and April 2nd. It's more than 1,000 people, most of whom are online, but a few are by phone. And the reason is that if you want a sample that really represents the whole public, you can't just have people who are online, because there are some people who don't access the internet or don't like to access the internet. And so you miss their perspectives, and that will give you distorted data. So we try to adjust for the fraction that are online and people who are still using phone. To do that, we use a panel of people. They've been recruited in lots of methods. So it's not like an online sort of, jump in and give us your view kind of a poll. It's a lot more expensive than that, as it turns out. And so in order to get really high quality results, we're using a really robust panel, which people have been recruited over time to make sure they're reflective of the entire population. We conduct all our polls in both English and Spanish. And then when we get the data back, we also make sure that it's weighted to reflect the true population. What we mean is, like, let's say you get a little more women or a little more men in your poll than is true of the population. We use statistical methods to make sure that it's realigned. So that means that you don't get distortions by virtue of, like, oh, you know, we had too many men in this, we had too many people with a college education, or we had too many people live in an urban area. We adjust for all the major things, and it's been shown that this is really the way you can find the most robust and accurate data. So we adjust by age, gender, race, ethnicity, education, urban status, and things that are what we call panel specific. We know we're doing a survey, okay? And so people who do surveys are a little bit different. One is, as I mentioned, they're more likely to be online, and so we adjust to make sure we have people who are doing this by phone. And also, it turns out that people who do surveys are, like, generally doers and, you know, are more engaged. So we adjust for civic engagement as well. So we don't just have, like, a lot of eager people in the survey. And we do a lot to recruit. And by we, I mean the people who run the panel, not me. It's a really important job, but it's a miserable job, and I'm glad I don't have it. Trying to encourage people to join and do the survey. So it's a really robust survey, and again, unlike some of the things that you might see in other environments. So I'm going to share with you a couple of the key findings. This isn't every finding we have. We did a lot of questions, but I want to highlight the ones that are, I think, most useful to the strategic goals for businesses in the context of pandemic response, infectious outbreak response, or planning. So the first thing is to try to sort of anticipate general and overarching support for sort of engagement in protective behaviors or policies that might be needed in order to keep the work of your businesses going. And so we ask them important questions of the public to try to sort of gauge their response. So the first thing we try to do is basically say, like, you know, do people think COVID is totally in the rearview mirror, right? Could this ever happen again? Or people like, that will never happen again, I can't even think about it, okay? Well, it looks like there's actually a pretty decent understanding that the risk of a future pandemic is somewhat likely. So what we asked here is that we said, in the next 10 years, could we see another virus in the United States that could cause a pandemic? And what we see is that 34% of people said it was very likely. Another 41% said it's somewhat likely. And then those two bars on the, or two buckets of that bar on the right said not too likely and not likely at all. So like a quarter of people. So basically about 75% of people think it's likely that this could happen. So it's like on their radar. They know it wasn't a one-time done kind of a situation. We also asked whether or not it was a priority for government to be addressing this. And so we asked first whether it should be a priority for Congress to prepare for future pandemics. And we see that 59%, so a majority of people, say it should be a top priority, and another third say it should be a lower priority. Very few people feel like we shouldn't address this. This just shouldn't even be on the radar. So I know sometimes when you read news articles, it would seem like there's a lot of people who are like, let's forget about it. That's the media's take on some of it. But actually, when you talk to real life people, when you talk to the people that you're serving, that are working for you and working with you, you'll find much more understanding that this is actually a priority. We also saw that it was a priority for state policymakers. And again, the numbers look very similar. And if anything, there's a little bit more view that the state policymakers should make this a top priority. We then asked about specific policies. Now, it's hard to ask about specific policies when they're not a particular pandemic. And people won't necessarily understand, like, different forms of transmission and sort of complications. So we kind of said, like, okay, if it kind of looked like COVID, okay, which is a little risky because, you know, you're going to, like, bring up people's anxieties about it or what they didn't like, et cetera. But we kind of need to get that on the table, right? Said, like, okay, would you support these kind of policies in that context? And we didn't shy away from describing them. So let me show you what they are. The first was a mask requirement. This was a requirement to wear masks in stores and businesses for 2 to 3 months when transmission gets high. So we didn't ask, you know, good requirements to wear masks for years and years, right? We kind of know that people have no tolerance that. But we're trying to think about, like, realistically, what businesses would have to do, right, is have masks in their environments, either people who are working there or people who are shopping there or people who are somehow interacting with their products and services for the time of peak transmission. And so how much would people support that? And I think if you look in the news, right, it would seem like, oh, people don't ever want to do that again, right? But in fact, people aren't totally opposed, right? So when we look at sort of the likely people, which I'm just going to say are like the two top buckets, very likely and somewhat likely, you get a pretty strong majority of people saying like, yeah, I'd probably support something like that. There's still a group that are like not at all likely, not too likely, I'm not denying that, but there's some support for these policies. And depending on your environment, you might see more or less, and we'll talk about that in a minute. The next kind of policy we asked about was healthcare worker vaccines, just as an example of something where we thought might be a little bit less well supported. And we saw that it was a little bit, but still like not hugely unpopular. So this is a requirement that healthcare workers get vaccines because the hospitals were getting overwhelmed and we sort of needed people to keep going. So if you work in a healthcare environment or that's your business, this finding might be particularly relevant for you. And again, think about the fact that we have a majority of people who are likely to support this kind of policy in the future. We then asked about dining closures. So if you're in the food industry or you're thinking about, people in sort of similar environments where people are opening their house together, sort of restaurants and bars will be required to close indoor seating or move seating outdoors for a couple of weeks when transmission gets high. Okay, so it's not a huge amount of time, but again, during peak transmission, what can you get? And again, you see like a pretty decent number of people saying likely. Again, it's not like huge, overwhelming support, but it's not the kind of pushback that we read about in the media either. And then we asked about school closures, which we also thought would be sizably less popular. It wasn't as unpopular as I thought it was going to be, to be honest. But we also kept it limited. We said public schools close for a couple of weeks when transmission gets high. So people can see sort of how that would work. I was thinking people would say like never closing again. But I think if it's time limited, there's actually much more support. So again, these are not super detailed. It's not a specific pandemic that we're responding to, but just something like this so we can gauge people's response to the kind of measures that we're likely going to have to put in place if there were another outbreak or another sort of virus with such potential. And we were trying to think about how to keep our communities and our workers and our customers safe in that for the time. So when we look across them, okay, so we're trying to think about like, well, what do we know about sort of how do we dig in on who supports them, right? So if you kind of look across them and you try to get like a general sense, we looked at how many people said they would be very or somewhat likely to support all four of those measures that we just talked about. And you have about half of people saying they'd be very or somewhat likely to support all of them. On the other end of the scale on the right, where you look at that 19% that's in the yellow, that's people saying they're not to or not all likely to support any. So across the board, they were like, nope, 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 nope. Okay. So it's 19% and then about half. And then there's mixed support, meaning that they were very likely to support at least one, but not necessarily all, for another third. And so the public is somewhat divided on it, but there again is like support for some of these measures that you might likely have to put in place to keep the business going. And we can anticipate that when people, and we'll talk about how to do this, but when people are communicated with in a way that they understand what the policy is, its purpose, its the limited nature of it, and how it's going to work, I think we can increase the support for particular populations that we're working with. But if we just take this as our starting place, it's not hopeless, as I think some folks have been worried that sort of in the wake of COVID, people would be so burned they would never accept any public health measures in these environments again. We do see that there's different support across different populations. Excuse me, I'm just going to pick a couple of different populations that might be relevant to you and the work that you're doing. When we look across racial and ethnic groups, we see that there's more support in Black, non-Hispanic, and Hispanic communities than there are in white non-Hispanic communities. So it's pretty substantial when we look at the fraction of folks who are saying that, yep, to everything, like I would support vaccines and masks and closures and all those things. You have almost 2/3 of folks who are Black, non-Hispanic, or Hispanic saying that they would, as opposed to 40% of white folks. We also see, and this is related, right, is folks in rural areas, excuse me, are less likely to support any. And so conversely, they're more likely to say they're not going to support any. They're in the nope category. It's still not a huge fraction. Okay, it's still like a quarter of people. It's not like 2/3 of people. Okay, it's still a quarter, but it's, you know, more than a quarter as compared to 13%. So again, it's not a huge fraction. We're just like, no, absolutely not under any circumstances. But that fraction is greater in rural communities. And so depending on where your businesses are, keep in mind, who are your specific customers, who are your specific employees, and how might their support vary depending on their experiences in COVID and subsequently. And of course, everyone wants to talk about sort of how this might be aligned by party. We certainly see partisan differences. So if we look at the category of folks who say they're very or somewhat likely to support all, you see there's really big differences, right? Democrats, 76% say they're going to support all. It's a yes, yes, yes. Okay, there's only 2% that say no. Okay, so massively supportive. Republicans are much more mixed. Only a quarter say that they're going to be very or somewhat likely to support all. A little more than a third say they're going to have mixed support, and a third say they're in the no category. I think what's surprising to a lot of people is that we look and we see like, okay, actually, even among Republicans, there's still a majority support for something. You know, I think there's this, there can be really negative perceptions of different groups, depending on the media presentation and what media people are listening to, about receptivity and people's like really good sense about common sense, like what might need to happen and where they can partner. And so I think there's a sense of connectedness here that could be extremely, could be leveraged in the context of a outbreak or a pandemic that I think, you know, is sometimes not, at the moment is not so obvious. So I think overall what I take away from this is there's support to build on, and you want to think about where the pockets of support are in your communities and the populations that you're working with. Now I have to think about like, okay, I gave some general policies, like, okay, here's some like tools that we know are commonly used to control outbreaks that are at least, you know, airborne in these ways. And so those might be common things to think about. But as we do so, how can we think about how we can adjust them so that they are the most appealing and most effective, right? So if we put in policies in place and then no one you know, agrees to do it, it's not going to work. And you're going to get bigger problems down the road. So it has to be things that the communities can tolerate and can understand and support. So what we asked about is actually what people are worried about. I said, like, okay, we hear you that like, okay, some policies are going to be okay, but what are you worried about? What are you concerned that like how these might be designed? Okay. Top concerns are that they would be based on political interest. They would be developed based on political interest. They would hurt the economy too much, or they're based on the interests of pharmaceutical companies and other big businesses. Okay, so these are top concerns. And what we're seeing here is that we ask people if each of them, you know, are you concerned? Are you very concerned, somewhat concerned, not very concerned, or not at all concerned? And what I'm showing you is the very and somewhat concerned groups together. Concern is at 83%. It's pretty high. Okay, so people are like, yeah, you can do these things, but, okay, so it's a little bit of a narrow path. And I think this is probably not too much of a surprise, but it's really helpful to see it laid out where you're like, okay, what are the rocky waters that I have to navigate here? So developing policies that are seen as being sort of, you know, handed down from political entities, it's going to be very concerning for people. So maintaining your independence and your reliance on good scientific information is something that's really important. And public health partnerships and businesses can help do that together in a way where they're on the stage together. That I think is a really important opportunity. You are worried about these policies hurting your business and the economy too much, and so is everyone else. So you are aligned in this, and it's something to think about. And when you talk about it, as you're actually designing policies. And of course, being based on the interests of pharmaceutical companies, other big businesses, things like, okay, we're going to do vaccines so that, you know, those companies can make can make money. That's what people are worried about. And that's sort of the background on those kind of things. So those are top concerns. But there are a lot of concerns. Okay, there are other things like be designed to appease the critics of past policies instead of making policies that reduce spread. So things that actually aren't effective. Further polarize our society. People are worried about what impact it will have in terms of the social fabric that we have together. And then there's sort of a collection of things where I'm like about 3/4 of people are kind of concerned. So being made without enough evidence to back them up, being applied too broadly instead of focusing on the most vulnerable people, staying in place too long, relying on mandates or requirements more than personal choice, unfairly stigmatizing people who cannot or don't want to comply, and not respecting people's religious beliefs enough. So when we think about all these concerns, you start to see like, okay, these are a lot of worries. Okay, so it's definitely like, I will do the things that need to be done, but, and our job as developers of policies and partners in public health is to think about how we can both anticipate these concerns, have policies that avoid these concerns, and communicate that effectively to people. Now, one thing that I want to point out is I showed you like, there's some differences in terms of people's views in different groups and, how people might view the sort of overarching policies. But these concerns are actually quite universal. If we just take that one, be based on political interests. Okay, we divide and looked at that among different parties. Sure, Republicans are more likely to say that this is a concern for them, but you're still talking about 75% of Democrats and almost the same fraction of independents. Okay, we looked at people in urban rural areas, almost no difference. Everybody's concerned about it. Among racial ethnic groups, everyone's concerned about it. We looked at this by gender, age, COVID morbidity status, parental status, education, income, everything. When you get numbers this high, these are really universal concerns, and so you can be sure that they will apply in your context. This isn't like, oh, but in my context, like your context will not be different. Everyone will be concerned about these things, and so navigating them will be especially important. Okay, so now we're going to think about sort of like what would it mean when we think about we're trying to develop policies that are, we have some support. We're going to try to develop policies that are, meeting needs, but also mindful of some of the risks that people are worried about. And then how will we tell people about it? How will we communicate effectively? And one thing we know is that we need to find trusted information providers and partners. All of us have limitations as different kinds of organizations with who we can communicate with effectively, because we are trusted and not trusted by different folks. And so getting enough people around the table where you show this is really like a shared value and approach is really the critical piece of getting information to communities. So what we did is we looked at, we said, okay, in a future COVID-like pandemic scenario, how much will you trust each of the following to provide health recommendations for them and their family? Okay, so top sources with greatest amount of trust, doctors and nurses. Okay, I would tell you, I have done polling on these kind of issues around trust on numerous issues on everything from H1N1, Zika, Ebola, polio, like any disease, any infectious, people's doctors and nurses, they're really the most trusted. I often say they have the secret sauce. Okay, the secret sauce is two parts. One, they are technically competent. They went to school for a long time. They know a lot about the disease. They understand how vaccines work. They know what the results are going to be. They understand how hospitals work, how respirators work, all that stuff. But they also care about you. They know you. They care about your family. They know your kids. That sense then that an entity cares about you is equal, if not more important, to having technical competence when it comes to trusting. So expressing that connectedness to your employees and your customers and your communities that you're working with is the secret sauce for getting people to work with you and partner with you during a crisis of any kind, but particularly infectious disease outbreaks. We also see there's trust in scientists working on health issues, friends and family who work in healthcare, local public health departments, state public health departments, pharmacists, and then we see sort of going down the list, CDC, NIH, Surgeon General. And what you see is like we're moving basically from like people and all the way down to sort of institutions. It's so much harder for institutions to show that they care. So that's another kind of lesson that's really important when we talk about communication, is that the more you can get people onto the stage, the more you can get, individuals, people with names, people that are known, the better you are to really connect. And I also want to point out, like, I'm looking at these numbers all the way to the right, right? This is the sum total of people who trust a great deal in someone. Okay. I also want to point out, like, well, who wears the great deal of trust? I also want to point out that CDC, for example, has a great deal of trust, higher than some others. And what this means is basically it's because there's like some controversial views. It's like a bit more polarized when it comes to federal agencies and public health. For some people, CDC is still a gold standard that's really worth connecting to. For others at local public health department, you can see that the great deal of trust is lower for public health department and state public health department, but the overarching trust is like a little bit more about the same, right? So It's like how deep is the trust and how wide is the trust? And you got to think about both dimensions when you think about partners you can bring. Now, these are also public health, or practitioners and then individuals, the organizations we think about. I want to point out who has less trust. Okay, now we get into things that are under a majority. State elected officials, their employer, local elected officials like the mayor, leaders in your church. Okay, now here's where people get surprised. Okay, first, everyone hates me when I say leaders in the church and synagogue are, etc., are less likely to be trusted. It's because we talked about that secret sauce. They have the compassion, they care about you, but they don't actually have the technical expertise. So if you have the technical expertise, like if you're a public health agency and you partner with faith communities, that's a nice pairing. That you got a magic sauce right there, right? So if you've got the compassion, find someone with technical side. If you've got the technical side, find someone with compassion. Make those matches, okay? So overall, I would say that elected officials often seen as having neither, okay? They don't care about you. They care about getting reelected, and they don't know what they're talking about. So that's a tricky spot where we talk about how you choose your partners. And some of you will be sort of required to connect with public officials in that way, but our elected officials, just keep in mind that there's a risk there. Now, their employer, okay? Now, this is a hard one, and I know it's hard for you all because many of you are employers. So if you are not as well trusted by yourself, the key is to find partners who are more trusted. So when you look, who can your partners be? You got a long list of them. These folks want to work with you. They want to keep your community safe. They want to help you work. And so finding partners who might have more trust in this circumstance is really a lot of the key benefit. And then bring out people within your organization who are really well trusted. Maybe that's maybe that's director of HR, maybe not, right? Maybe that's your CEO. Don't know, but who is sort of in the workplace who can have that same role? Is there a medical team in your, as part of your business, part of your entity? Is something to think about how we do that. So the key again is find partners who have that secret sauce together, technical competence and caring for people, and you will find a much better way to connect with people. Okay, I'm mindful of time, so I'm just going to summarize a little bit of what we've talked about, make clear what I think the implications are, and then open it up for questions so we can have a discussion. I know there are things coming in the Q&A, and I apologize that I can't answer them yet, but we'll make sure we have time to do so. So what does all this mean? Okay, I told you it'd be interesting data, promised. Now, what does it mean sort of for business and public health organizations working together? So first, in terms of we do this to try to understand, like, do we assess and build support? What's the foundation look like? And I think that really is a pretty solid support for key mitigation policies if there are future pandemic or other kinds of outbreak. I think the news would like to present that it's solely divided in some places, there'd be no support in some places. It's not totally true. It doesn't mean there's not pockets of support and opposition. Think about the communities that you're working with and what their backgrounds are, what their experience for COVID were. You probably have a good sense of that. But I also think it's important, and it's a little bit of a message for public health as well, is like not to dismiss outright. Okay, there's still a lot of receptivity, and in a crisis, people do want to come together and support one another. So building on that. Thinking about that there really is a foundation to build on, and recognizing the characteristics of the group that you are working with will help you assess the particulars of your situation. Designing policies that motivate people. I think it's really important to recognize that even among people who are like gung-ho, right? They're like, yes, yes, yes to all those policies. They still have concerns that the particulars of those policies would be unreasonable or have outsized negative impacts. So what can you do? First, think about policies that are going to have the greatest appeal, okay? So target the people most at risk, so, target support, but highlight sort of, are there people who we really worry about, and can we support them so that everyone is not inconvenienced in some way? Think about that. Have understandable time limits. We're going to do this for an amount of time, and then we're going to reassess. Have a perception that there's limited outside influence. So think about who's on the stage with you when you present these conclusions. Think about resources you connect to and say you're going to be sharing with or relying on. And also think about the limited economic or budgetary impact. Now, of course, not every policy can be like, okay, don't worry, we're just going to put a mask for one day on this one person and it'll all be solved, right? Like, that's not how it works. Everyone is going to there'll be some burden of this. So even if you have to develop a policy that is not perfect, okay, that people don't love, acknowledging people's potential concerns, discussing the way you've tried to address them, that's critical in motivating support and making you not feel like you're totally distanced, like we didn't understand where you were coming from. Like we know where you're coming from. We're going to try to acknowledge that. We're trying to do the best we can, and we're going to have to work together to get through this so that we can be successful on the other side. And finally, sort of leading into that is how we're going to communicate effectively. We know the most widely trusted sources include people working on health issues, doctors, nurses, scientists, again, for that sort of secret sauce duality. And there are also institutions with wider trust. They may not have as deep trust, but it's pretty, wide, which is great. And so when you're sharing information, look for trusted partners who can help connect your message. Think about doctors and nurses from your community. Okay, they make great spokespeople. Connect with them. I often say, like, find someone with a white coat and a stethoscope. That is your goal. Get on stage with them, because that is going to be really a great way to connect. Reference sources that people trust, even if they're not sharing the stage with you. So even if you don't have CDC with you, but you know that your community really trusts, like, the sanctity of federal data, or they're more worried about it now. Then they want to go to local and state public health departments. Think about, can you reference them? Something? Can you this is what we got from them. We're working with them, even if they're not on the stage, and make sure you link with resources. So thinking about all this together, I think there's a really good blueprint for effective planning in the future. And looking forward to hearing your questions about how we can do this together. So I see that Dr. Emery's come on the stage. So let me hand the microphone over, and I'm happy to answer questions or let other people talk and share with you.
Thank you so much, both of you guys. That's there's a lot to digest there, but very, very interesting, and is certainly in line with the objectives of TEPHI. I know Janelle and Rocio have been assembling questions, but the beauty of this is I get to ask the first one just because I control the microphone. So, and because I have a personal interest in this for another reason, and it has to do with the definition, not getting down in the weeds, but the definition between a poll and a survey. But because we're grappling with this on another project, and as soon as you said this, I was like, oh, hold on, so again, I don't want to derail the whole conversation, but if
I like that we're digging right into the nerdy questions.
Okay.
I like it. Okay.
Well, yeah. Okay,
you should PhD, man. We're gonna get right in there. Okay.
There we go.
So, survey is technically an umbrella term for a standardized way of asking a population a question.
Yeah.
And aggregating the results. There's not necessarily a specific definition of poll within that, but it is usually thought of as a subset of survey research.
Yeah.
And polls typically have specific characteristics. So polls are typically focused on people's opinions, less on people's experiences and behaviors, but sometimes I put that in there because I find it really useful. And there's some methodological sort of similarities between polls in terms of their overall size and the weighting, and there's some standards. So the American Association of Public Opinion Research puts out standards for that we follow that ensure the credibility of findings and transparency in terms of sharing the results.
So is it safe to say that, and again, we're going to get to the questions here in a second, the other ones that are actually more important than me. I'm just curious, in your opinion, polls are more leaning towards folks' quick opinions, whereas surveys might be more, I don't know the term I would use, but methodological, I guess, maybe.
So there's two different differences. One is that, and it's just general tendencies. So one is the subject area. So we have to ask people about their views on things. Less about, like, we could do a survey and ask you what you ate for lunch and what you ate for dinner. We could do like a food journal, and we can, that is also a survey, but it's not. Right? It's not any more or less rigorous. It's just got a different objective and a different kind of.
That's.
Whereas I would ask about, like, how do you feel about food programs and nutrition programs, and what do you think are the risks of this? And so that's sort of the major difference.
Okay. Cool. All right.
And then there's different methods that go with that, because
but both are important. And the
general population.
the information gleaned from both is very important, but it's just kind of interesting to me. Yeah.
Yes, and I teach survey methodology overall at Harvard.
Okay.
So I teach polling as one aspect of that, but lots of surveys that I feel is experience.
Okay, I didn't know I was hitting a nerve there. Sorry.
No, not a nerve at all.
Okay,
I can go
that'll
on
be a
for
whole
days, so
nother
just be careful.
talk there. So,
Yes.
okay, let me kick it over to Janelle, and I don't know if you synthesize. We have 5 minutes there, so yeah. So
Yes.
thank you so much. Yeah, sorry.
Yes.
Sorry.
This was excellent, and we do have several questions that have come in. And some of these questions we received them prior to today upon registration. And I do want to go a little bit into trust and about the doctors and nurses being the most trustworthy. So we have a couple of questions about that. And maybe you've already answered them. Did your poll results or does other recent research describe trust? Specifically, does the general public trust public health organizations? And you talked a little bit about CDC versus local health departments. Mm-hmm. And there's a follow-up question to that, is seeing that so many people seem to trust CDC, why then does it seem that people don't trust, at least at that same level, local health departments?
So a couple of things. These are really important questions, and I think it's sort of an ongoing area of investigation. I've been really trying to look at the way that trust in institutions shapes people's willingness to adopt behaviors in emergency contexts for a long time. So we really care about trust because without it, we really can't help people. So we need them to trust us. And so what we learned over time, right, is that the level of trust does sort of increase and decrease depending on the circumstance. So often at the beginning of a crisis, actually trust is suddenly much higher. And then over time, as the reality of the circumstance comes in, we see it wane. Now, sometimes the media sort of says like, oh, we're just losing trust right and left, right? Okay, we would expect that actually. In any crisis, you're gonna start. And what we saw, for example, the trust was higher at the beginning, then it kind of went down. When the vaccine came out, trust went up again. And then it was like, oh, the vaccine isn't gonna solve the whole problem. Trust went down again, okay? People get discouraged. So what we try to do is think about sort of ways that we can enhance trust in the institutions. I think we're coming to a point where obviously having a changeover in the leadership of many institutions. And so I would expect that some of the results on trust will shift over time as different folks are in positions of control and people, the organizations sort of change policy focus or their approach. So I would think that different people will trust more and less. I actually think trust may go down overall again at the federal level, because the people who trusted it before will no longer trust, and the people who didn't trust before generally don't trust. So we look at people who really don't trust the CDC. Turns out they don't trust a lot of people. They don't trust their local public health department. They don't trust the doctors. They sometimes trust friends and family, but not always. It's low across the board. So, that's a larger challenge for the current administration, I think. Mm-hmm. We also saw that, there's wider trust in your local and state public health, but it's not as deep, right? So there's not as many people saying very trustworthy. And we looked into that in other studies, and I'm happy to share those as well. It derives in part because it feels like the federal agencies have responsibility and expertise in data and in technical sort of research. And so people look to them as sort of a more a greater authority in those areas. State and local have more advantage in terms of trust and understanding the communities, providing direct services, working really hard, sort of having people know who they are, and you can build on that. Again, I think with the change in administration, I think that may shift a little bit, or a lot, depending. And I think there's actually a greater role for state and local public health agencies to be connected to their communities and to be serving them in that way. So that's something to keep an eye on, I think, as we think about partnerships in the next little while. I saw Sarah come off her mute, so I wanted to make sure to.
Yeah, I did want to just name, and I appreciate Gillian you naming that, it is hard to measure trust, but I think what we found also in our work is that obviously trust is central to being able to do any of this work. And so what we're finding is that it's a mix. Sometimes people don't even understand what public health is. And so to trust what an institution is when they don't understand what we even do is really, really hard. And actually, we just recently put out some research on better understanding public health and messaging around public health, which we can share with your audience as a resource after today's session. But that is one piece of it. But we recognize also that trust building is honestly on an individual level, like a one-on-one basis, making connections and relationships with people in your community. And so it's a both and. We wish we had a magic wand to build trust, but I think it's an ongoing process for sure.
Okay,
Thank you.
so hey, I'm sorry,
yeah.
all of us, we're gonna have to bring it in for a landing here, but we will do our best to compile these other questions, and I think through email we'll try to post, some succinct responses. It's been a great presentation. I wish we had another hour. It's really interesting what you guys shared. But thank you so much for taking the time. Janelle, do you have a few closing comments on what folks need to do?
No. We definitely had some wonderful questions. We will send them out. And in fact, folks really were interested in the results of the poll. And everybody, please remember to fill out the survey that is about to pop on your screen. And please let us know if there are any other topics that you'd like us to cover in the future.
Okay.
Thank you guys so much.
So Gillian and Sarah, you guys come to Houston. I'll validate your parking and Janelle will buy you lunch. How about that?
That sounds
lovely. Thank you all.
All right.
Thanks,
Thanks, you guys.
Thank you.
All right. Thank you.
Bye-bye.